Janelle Johnson-Thiel was not able to be here today. My name's Elizabeth Songalia. I'm also a nurse at HCMC. Janelle has been an RN at Hennepin County Medical Center for 16 years, and she currently works in the birth center. We, the nurses of Hennepin Healthcare, who are represented by the Minnesota Nurses Association, must speak out as devoted advocates for the safety of our patients, the well-being of our community, and the welfare of our tireless workforce. Our concerns are not mere murmurs. They are heartbeats of a committed healthcare team who, day in and day out, give their all to provide exceptional care to those who rely on us. Over the years, Hennepin Healthcare has evolved and faced numerous challenges, but the commitment from the commissioners of Hennepin County has never been more crucial. The heart of our distress stems from the recent Minnesota Department of Health report, which disclosed that in 2022, our institution contributed to 10% of all reportable adverse events in the state. These events are not mere statistics. They are tangible, real-world occurrences that impact our patients' lives, our community's trust, and the very essence of our healthcare institution. It is an alarming fact that in a single year, the number of such incidents has doubled, with a staggering 60 adverse events reported in 2022. These occurrences are directly related to staffing shortages, which not only jeopardize patient safety, but also affect our ability to sustain financially. Nurses, the backbone of Hennepin Healthcare, continue to bear the brunt of chronic understaffing, which contradicts expert findings stating that it's not a shortage of nurses, but a shortage of safe, supportive working environment. The fact that we, the nurses, felt compelled to picket in 2022 for the first time ever underscores the gravity of the situation. An internal survey conducted by the Minnesota Nurses Association revealed that a staggering 81% of respondents believe patient safety is at risk. Workplace violence and harassment are rampant, with 97% of nurses reporting such incidents in the past 2 years. But a lack of time, understaffing, and inaction by hospital management deter them from reporting. Under the leadership of Jennifer DeCabelis, our employee benefits were slashed, premiums hiked, and deductibles inflated, leaving our workforce with a heavier burden to bear. This, as the CEO awarded herself a massive raise while claiming a budget crisis, is not just preposterous, but a slap in the face of every nurse, caregiver, and employee who gives their all to this institution. Due to all of this, we see needed change at Hennepin Health System, and ensuring that Hennepin County Commissioners have the ability to approve or not approve the budget is a step in the right direction. Please support House File 4744 to help workers and patients at our valued Safety Net Hospital.
So my name is Jeremy Olson-Ellert. I'm a registered nurse at Hennepin County Medical Center and an MNA co-chair where I've been employed the last 10 years. We find ourselves at a pivotal moment where the very essence of our health system is being questioned. Behind the walls of statistics and reports lies the profound truth. The human cost of decisions made without empathy, without understanding, and without public transparency. Let me describe what the recent budget changes mean for HCMC staff. Imagine a mother, a nurse, whose world revolves around the fragile life of her daughter with a rare genetic disorder. Last year, our healthcare plan provided a lifeline, a safety net of support that eased her burden. But now that safety net is unraveling, replaced by the barriers of bureaucracy and increased costs. Her daughter's medication, once easily accessible, is now mired in delays and financial strain. Or consider another nurse who has relied on a specialized medication for over 2 decades. What was once manageable expense has now become a financial burden, a toll exacted by a system that fails to recognize the value of human life over profit margins. And then there's the reality of delayed care. A nurse's son suffering from horrible allergies waits months for an appointment only to have it canceled due to circumstances beyond their control. In a system where every moment counts, this delay can mean the difference between comfort and agony. These stories are not isolated incidents, they are echoes of a system in crisis. Yet, when we raise our voices, when we seek accountability, we are met with hostility and indifference from those entrusted with leadership. So much so that when the Hennepin County Board appropriated $8 million to fix our health plans, HHS leadership chose to spend only half of that to slightly improve our health plans, but we do not know where the rest of that money went. We feel that there was no meaningful investment in retaining workers, there was no meaningful plan to reduce agency nurses, all while the hospital board's first action was to again raise the CEO's salary. We have over 100 open nursing positions right now and continue to see more nurses leave every month. During the HHS budget conversations at the end of last year, nurses heard from commissioners that they had deep concerns about the budget and the lack of meaningful investment in workers. This after there was a large investment in federal pass-through dollars that we helped to lobby for at the state legislature, and no conversation with direct care staff on what they need in order to provide quality patient care. Yet, the commissioners were informed that they were legally required to pass the budget. This is not how Hennepin healthcare systems is supposed to work. But due to the way the language is written in Minnesota statute, there is very little ability for the Hennepin County Commissioners to have meaningful oversight into the budget. We are asking you to make a simple change. Please support House File 4744 and help take a step towards better fiscal accountability and transparency at our public safety net hospital.